diet, nutrition, and health. We have got really good topics today. We have 3 topics. And the first one is diet and long-term skin conditions. We have got Dr. Chiner. She's a GP registrar with special interest in dermatology. She's going to talk to us about diet and long-term skin conditions. Then we have got Dr. Rajiv, GP registrar. He's going to talk on diet and cardiovascular health. And then after that, we have got Dr. Serena. She's going to talk about role of diet in type 2 diabetes mellitus. So I think now I'll pass over to Dr. Chiner to do her presentation.
Okay.
And just one more thing, sorry. We are going to record this webinar and it will be shared on the YouTube channel, Healthy Brahm YouTube channel. And also, if you have got any questions, please put the questions in the chat function. And because Dr. Chiner has to go a bit earlier, so she will try to answer her questions after her presentation. And then for the other 2 speakers' questions, we'll get back to them at the end of the presentation. And we'll also be sending a feedback form. So it will be really good if you could spare a couple of minutes to fill the feedback form for us. Thank you. Now I'll pass over to Dr. Chiner.
Okay. Thank you. I'll just try to share my screen again. Oh dear, what am I doing wrong? Share screen, okay. Does it come up as a PowerPoint?
Yes, you just have to make it, sorry. Yeah, you just have to make it into a presentation mode.
Before I share it?
Yeah.
I can't see the options.
Yep.
No. Just give me a second. I think I've missed it.
Yeah. So we can see, does it not go into the presentation mode? Yeah, if you go.
So this
Yeah,
one.
if you go there, yeah. Put it into the slideshow mode.
Okay.
Yeah, that's it. Yeah.
Okay. Sorry about that. I'm not so technologically savvy. Hello, everyone. What did I try to come up? So my name is Chichi. I'm one of the GPST ones. And I have a lot of special interest in dermatology. So I've done a bit of derm training in Nigeria and a bit of, I've done another diploma while I was here in the UK. And I try to keep in touch with dermatology. So I was very glad when I was asked to give a talk. I actually kind of volunteered to give the talk because skin for me is everything. And this is a very good topic, especially in light of the pandemic and what has been happening. So diet and chronic skin conditions. What effects does diet have on the skin? What effect does the skin have on diet? It plays a lot of role in skin health. What you eat, you are what you eat. I know it's a cliche, but that's the truth. What you eat determines what your skin is going to be like. It's going to affect your entire body system, and your skin is not exempted. So just a brief explanation of what the skin is composed of and what makes up the skin and what are the functions of the skin. So you have the skin as the largest organ of the body. So it's protecting us from a lot of things, environmental insults, chemical insults, protecting you from UV radiation. And apart from the fact that the skin does a lot of functions, it has aesthetic value. So it's what, you know, you use when you want to show off what you look like. So it is a very important organ. There are different components to the skin. Medically, we're going to say, oh, it's made up of the epidermis, the dermis, and all that, but that's not the important thing here. Functionally, you have the physical layer, you have the chemical layer, you have the organisms that live on the skin, and you have a bit of a microbiome. So all these are important in protecting the skin. The physical layer is the one you can see, the outmost part of your skin. It's composed of your epidermis. The chemical layers are the amino acids, the nutrients, the lipids that make up the skin and try to bring the tissues together. The microbiome is organisms that live on the skin. So everyone has an organism. You have so many organisms living on your skin, living in different areas of your body. And the reason why you have those microbes on your skin is to make sure that the pH of the skin is normal. It allows you, it protects you from other organisms that can come on your skin. This slide I've put up shows the different micronutrients. So when we talk about what we eat, you know, we have glucose, we have proteins, we have fats, we have vitamins, we have minerals. Each of those meals, when broken down, have different functions in the skin. So glucose is important in keratinocyte differentiation. It's what helps you with production of your keratin. However, you don't want to have too much of the keratinocyte differentiation, because what that means is that in the presence of excess glucose, the skin would continue to grow, the outermost layer of the skin will continue to grow faster and faster than it should. Every cell in the skin will grow more. Melanin increases, so you get darker, essentially. So you just want an optimal level of glucose in the body. When you come to your proteins and amino acids, they make up the building structure of the dermis. That's the skin layer you cannot see. So you have things like collagen, elastin, fibronectin. Those are the proteins that hold up the skin. They are the proteins that make the skin supple. They are the proteins that make sure that the skin is intact, protects you from UV radiation, helps with wound healing. So that is the function of collagen and elastin in the skin. And it keeps the skin smooth, you know, less wrinkling. It looks supple, nice to look at. The lipids, which is the fat component of what you eat, is responsible for keeping your membranes intact. It keeps movement of water in and out of the membranes intact. It ensures that you're getting in enough fluids and you're not losing too much fluids at the same time. So it's responsible for the hydration in the skin. This is a very crowded slide, but I just had to put it because it was the most comprehensive slide I could get for vitamins. So there's so many vitamins, and the most important ones are vitamin A, the Bs, biotin, selenium, pantothenic acid, vitamin E. When it comes to the skin, vitamin A, E, C are extremely important because they're very important in wound healing. These are the strongest antioxidants you have. So they mop up all the free radicals. Usually when you have metabolism happening in the body, anywhere in the body, whether it's in the blood, anywhere, it generates free radicals, which are toxins and which should be mopped up. The same thing for the skin. When things are happening in the skin, it generates free radicals, which should be mopped up. And these are the functions of these antioxidants. There are also other antioxidants like glutathione that can mop up free radicals. So this is just a slide showing that. I've just added this to the slides to show the different sources of, you know, foods where you can get some of all these important antioxidants from. However, When it comes to problems in the skin, what are the pathophysiologies for chronic condition? The basic thing is inflammation. Inflammation, inflammation, inflammation. The same way you get it in diabetes, you get it in hypertension. It is the same underlying mechanism in the skin. So when you have inflammation from any skin condition, whether be it acne, be it psoriasis, rosacea, different kind of skin conditions, it generates a systemic reaction. And all these things are happening. You have things like hyperinsulinemia, especially with high glucose diets. Once you have hyperinsulinemia, it goes to the IGF receptors, which are receptors in the skin that tells the skin to start to grow, thicker. The surface of your skin grows thicker. It starts to mix up with the proteins under the skin and the dermis. They're not able to function as they should. Also, there is a new theory about what you eat and what happens in your gut. So the gut microbiomes, usually you have the same beautiful organisms that are living symbiotically with you on your skin. You have them in the gut, different types of organisms. They keep the gut intact. However, there are new theories postulating that when you have an imbalance or a disbalance in the organisms in the gut, it causes leakage. The epidermal layers, the layers in the skin, it causes leakage of toxins. Those toxins move from the bloodstream to the skin. So this is a big area of research right now in atopic dermatitis. But without boring you more, let's go to the different skin conditions. The commonest ones are acne, atopic dermatitis, especially in children, psoriasis, rosacea, skin cancer, aging, and obesity. Research has shown that what you eat can affect each of all these conditions, either in the establishment of the chronicity, either in modulating it, and in the treatment. So what evidence do we have? Acne has the widest amount of research right now with regards to what you're eating. High glycemic foods have been evidenced by a Korean research to show that it exacerbates acne symptoms. So this was a study done in North Korea. They had two sets of patients. One was the case, one was the control. The first group was given low glycemic diets. The second group were told to just eat as they were. And this was done over a period of 10 weeks. There was a nutritionist involved who looked at the diet, made sure they had enough proteins, they had enough lipids and all that. These are the changes that occurred over the 10 weeks. We could see that at the beginning, at the baseline, acne severity, which was measured using the amount, you had to calculate the amount of comedones on the face and scarring on the face. At the beginning of the study, severity was almost the same in both groups. But if we see with time, by the time they got to the 10th week, there was a significant difference in those who were on the low glycemic diet. Same thing with inflammatory lesions. At 10 weeks, there was a marked reduction in inflammatory lesions on the face. Also, for acne, there's been a study that shows that cow milk and dairy are very implicating. I'm not going to talk a lot about that, but it's the same thing. It shows that cow milk and dairy in some individuals will exacerbate the severity of acne. So sometimes if you have acne, you just have to watch what you eat. Is there anything that is specifically exacerbating? And this study is backed by the fact that in some populations in the world, there are some populations who have never had acne. I think the Maori and Papua New Guinea, there's never been an incidence of acne in those populations. And that's because they've looked at their diet and it's been associated with the fact that they don't have a high glycemic diet. For atopic dermatitis, apart from the gut syndrome, the leaky gut syndrome that has been associated with it, food can exacerbate the skin condition, especially when you have allergy to food. So some people would react to things like milk, gluten, sensitivity. Different foods can cause an exacerbation. So you can eat the meal and you have a reaction immediately. That's the immediate type. Sometimes it happens later on. So there are different ways to test for this. And that's why in some children, when you have children with atopic dermatitis, a mom comes to you and says, when we eat this, when we eat that, it seems like the skin is flaring. So you need to refer them to the allergy clinic or for patch testing, depending on the pattern of reaction. Also, in atopic dermatitis, it's said that when you eat lots of probiotics, it improves. And that is also an indication, it's like a backing up of the same theory with the leaky gut syndrome, because what probiotics and symbiotics, what they do is that they replace the gut bacteria that you should have, usually the good bacteria in your gut. And it's been noted that in children with reduced gut bacteria, the atopic dermatitis is actually more severe than the ones without probiotics and symbiotics. Psoriasis. Psoriasis is a very chronic inflammatory lesion. It's now known to be a systemic disorder, and it's now part of the metabolic syndrome, which is hypertension, diabetes, I think cardiovascular disease, and obesity. So when you have a patient who has psoriasis, it is in the interest of the patient to try to lose weight, because losing weight would improve the symptoms. It improves their response to other treatments that you're giving. And also, it actually gives an important benefit of helping the patient get better, because that will also improve the other symptoms they have with diabetes, with hypertension. So most times when you get a patient who has psoriasis and the patient does not have diabetes or hypertension, you need to explain to them the importance of not gaining much weight, of not being obese. If they're not yet obese, they have to watch their weight. And the best way to do that is to eat healthy. However, there's a small subset of patients with psoriasis who have gluten sensitivity. So some of them will tell you, just like if you had celiac disease or you had dermatitis herpetiformis, that when they eat gluten meals like wheat, barley, rye, it triggers their symptoms. So it's encouraged that you need to check for celiac antibodies in this subset of people. Skin aging. So there are a lot of factors that contribute to skin aging. You have the exogenous factor from UV radiation. You have the endogenous factor. As you're aging, your skin is aging. But in younger people, there are some factors that encourage rapid and accelerated skin aging. High glycemic diets, especially high glucose diets, would cause that. And the reason is, like I explained, there is a lot of inflammation going on. It damages the proteins in the skin, especially the elastase, the collagen. It causes a lot of wrinkling. The skin is unable to hold itself up. And that's worse if you have someone who's also smoking. So that worsens it. There was a study that looked at glucose levels and age for different people. And it showed that those who had high glucose levels and the aging of the skin, it correlated with an increase in the age of the skin. Also, there is, it's important to look at the mode of preparation for the meals. So if you're frying your meals, you're grilling, there is a tendency to produce those free radicals and glycation end products that would damage the skin. So less grilling, less microwaving, less frying. It's actually better to boil. So, and there's some meals that you're going to prepare that would produce more end glycation products. And that's very important to know. skin cancer, with regards to the initiation of skin cancer, diet has not really been implicated, but with regards to the promotion and progression, it has been implicated in that those who have diets less in antioxidants, less in vegetables, less in whole plants, have been shown to have more progression with non-melanoma skin cancers like basal cell carcinoma, because antioxidants mop up the free radicals and they prevent damage to the DNA of the individual. So there was a study that showed that those individuals with less dietary levels of antioxidants had more progressions with their basal cell carcinoma. Another thing the same study showed was that they had two groups. One group took only fruits and vegetables and whole plants. The second group took tablets for their vitamins. And it showed that those groups that had their vitamin sources from their food functioned better, and there was less progression of the BCCs that they had. I think I can't finish this presentation without talking about obesity, because that's the big thing right now, especially with everybody being indoors. It's been very hard for everyone. The skin reacts when you add weight. That is, you can see it. It's very obvious, especially if you're a dark-skinned person. Your skin becomes darker. You're prone to skin infections. You're prone to you're prone to striations. You're prone to different new lesions. If you had pre-existing lesions like psoriasis, it worsens it. So in obesity, it's very important. If you want your skin to look good, you want your skin to be healthy, you want your pre-existing skin condition to, respond better to medications or whatever treatment you're giving to it, it's important to try to lose weight. So this is just a summary of all the skin conditions and the triggers. This is for acne, psoriasis, aging skin, eczema, and atopic dermatitis. So what diet would we recommend for the skin? There's so many kinds of diet out there. The first thing I'd say is water. Water is a diet on its own. So you need to drink a lot of water because that will hydrate the skin. Secondly, there is no one diet that fits it all, because if you have atopic dermatitis and you have food allergy, I wouldn't tell you to eat those meals that would, flare up your skin reaction. However, generally, looking at all the evidences, a low glycemic diet is extremely beneficial to the skin. And this is a table looking at whole food plant-based, and those ones that have the highest number of antioxidants that you need to mop up all the free radicals. It also looks at the cooking effects on how much vitamin you can get. So if you overboil or you overcook some of them, you're not going to get the same amount as if you've eaten them raw. Same thing here, the various methods of preparing the vegetables and the fruits. When you microwave, you fry them, just bear in mind that you're going to produce more glycation end products, and that's not very good for the skin. It ages the skin early. So these are my references. I hope I haven't taken too much of your time. And thank you for listening to me.
Thank you, Chichi. That was really good presentation. If anybody has got questions for Chichi, she has to go a bit early. So if you can put it in the chat box, that will be good. Thank you.
I'm going to stop sharing.
Thank you, Chichi. Just give a couple more minutes and then we'll pass over to Raj.
However, if there are no questions now, I can always look in by 5 minutes to the end just to check if there are questions for me.
That will be good, Chichi. Thank you.
Yeah.
Now I'll pass over to Raj.
Oh, hi all.
Yeah. Just one question, if you can answer that, Chichi, before you go. Is the impact of microwaving in the waves or the oils?
Is it microwave? What do you mean by waves? Do you mean like electromagnetic waves?
I think they meant probably the microwaves, the waves of the microwave, or
Okay.
whatever the technology probably.
Well, it does look like it's a combination of both, because when you fry, you get end products anyway. Even if you microwave, you get end products. So I think different modalities have different amount of end products of glycation that they produce. But I'm going to assume that things like grilling and frying would produce the greater number of end glycation products, because when you're frying, you remember you also have to use your vegetable oils, and those will produce different things also into the meals. So it's not just about the waves or the oil. I think it's a combination of both of them.
Yeah. Thank you, Chichi. Now I'll pass over to Raj for his presentation. Thanks.
Hi, also hi. Yeah, my name's Raj. I'm one of the GP registrar, currently working in Solihull, and about to enter my last year of training. So I thought I'd give just a general overview of eating well and heart health. It's quite brief, and it's quite generalized, but I've sort of tried to sort of link different parts to some of the aspects that I've thought about are important in trying to maintain our cardiovascular health. So obviously we know why heart health and cardiovascular health is really, really important. And I've just pulled some of these quite stark statistics from the British Heart Foundation. So we know that 7.6 million people in the UK are living with heart and circulatory diseases. And, you know, as you can imagine, that's a massive number. And often people with heart and circulatory diseases and often don't know that they've got a problem until, you know, something very serious happens, such as a myocardial infarction or a heart attack. So we know it's a big public health issue, cardiac disease among all different age groups. So that includes from babies all the way up till, you know, older adults, where we tend to see more hospital admissions with cardiac problems. So there are 450 deaths every day from a heart-related disease, and approximately 100,000 hospital admissions every year due to heart attacks. And that number, if you look at public health statistics and statistics, that number just keeps going up and up and up. So we know that, you know, even today there'd be thousands of admissions across the country with heart attacks, and strikingly 1 stroke every 5 minutes. So we often think about our cardiovascular health as just our heart, but we've got to remember that our cardiovascular health includes all our circulatory system, which includes all the arteries, you know, surrounding the heart itself, but then also all the arteries that's supplying our brain. So cardiovascular health is really important. And we know one of the key elements of cardiovascular health is lifestyle. And a part of that lifestyle is diet. So lifestyle with diet included in that is one of the key things that we need to think about in terms of primary prevention to keep our heart as healthy as possible. So yeah, that is why healthy eating is important. So it's trying to educate people and you know, start this education even in school systems about primary prevention. So really reducing your risk of getting cardiovascular disease. And once you start to look at your diet and look into healthy eating, this also then provides a cascade into other benefits. So preventing, that should say weight gain, sorry. So preventing excess weight gain, because we know that obviously obesity is a massive, you know, pandemic across the world, particularly in developed countries such as the UK. And then reducing the risk of diabetes, hypertension, and other chronic health problems. So healthy eating kind of encompasses lots of aspects of lifestyle medicine. And it's not just about cardiovascular health, but also about reducing your other risks, for example, weight gain, diabetes, hypertension, which all then feed into your overall, you know, cardiovascular health. Now, I just thought I'd put a little section here about is food medicine. There's a lot of hot debates around practitioners, particularly people interested in lifestyle medicine, about whether food is medicine and the message that we should be putting across to the public. Now, we know that food and healthy eating choices are massively beneficial to our overall health, not just cardiovascular health, but overall health, overall fitness. But we need to remember that there is still a significant role for conventional medicine in the UK, and that food is not always necessarily medicine, but healthy eating and promoting a good diet should be part and parcel of a person's overall healthy eating and healthy lifestyle habits. So I'm just thought I'd mention a little bit about plant-based diets. Now, I'm sure everyone's heard the term plant-based diet, and I'll go into it a bit in a little bit later about what actually is a plant-based diet. But I think when I was looking at cardiovascular health, and one of the main sort of studies and research that is coming out at the moment is really about focusing on whole food plant-based diets. Now, what this really means is it's not particularly things that you see on the shelf that might be labeled plant-based, but really looking at minimally processed plant foods. Now, I think with the advent of dry veganuary and a lot more people wanting to try veganism, which is fantastic, I think there's been a rise of ultra processed foods. So we've seen a rise in a lot of these fake meats and other sort of vegan products, plant-based products, which are not necessarily the best thing for us, particularly when we're impacting on our cardiovascular health and overall health and fitness. So it's really about focusing on whole food, plant-based, and the emphasis particularly on whole food, because with numerous studies that showed that the more you eat ultra-processed foods, and you can be eating a very vegan, ultra-processed diet, that is going to massively impact on your cardiovascular health and your overall outcomes. So we just need to be educating about what is veganism, what is a plant-based diet, and actually how do we go about accessing plant-based options and looking around in the supermarket and just having that general knowledge about what is minimally processed. So this is I've just pulled from a website that looked at sort of plant-based and vegan options. So it sort of compared what a vegan diet was, a plant-based diet was, and a whole food plant-based diet. So you can see here that we try to limit meat, poultry, seafood, eggs, and dairy products. Now, I think it is about having a conversation with patients and even with the general public that we know, and everyone knows that it is very hard to have such a restrictive diet. And a lot of the conversations around healthy eating and improving our lifestyle and improving our cardiovascular health is really about being flexible and making sure that you are choosing the right choices when you can. So it's about not being strict with your choices, but making sure that when, if you do choose to, you're in a restaurant, you're in a supermarket, just being mindful about what is whole foods and what, if you can, lean to plant-based diets. So that may mean, for example, having 1 or 2 meat-free days a week, or, it may mean turning vegetarian, but I think there's different options for different people. So you can see here that plant-based diets do include the highly processed food, which I mentioned before. So these refined sweeteners, bleached flours, white rice, lots of things with dextrin and other additives, which can be really, there's not much research about it, but it's been shown that it can be quite harmful. So it's just about making that right choice. And we know that a whole food plant-based diet, there's lots more studies around it at the moment that these types of diets, when you adopt these types of diets, these are the best diets for overall cardiovascular health. So often when we think about food groups, traditional food groups, which I'll touch on a bit later, we often think about carbohydrates, dairy, meat, fruit and vegetables. But when you look at plant-based food groups, these are sort of super 5 plant-based food groups, which if you increase your intake of, will naturally improve your cardiovascular health and naturally improve your fitness. So obviously we've got fruits and vegetables, but when you actually break it down, people are sometimes not aware of the different other types of plant-based food groups that you need to be trying to get into your diet, particularly things like tubers, which are root vegetables, sweet potato, beets, whole grains, cereals, millet, and legumes such as beans, lentils, and pulses. Not only are these good whole food plant-based options, they're also really good source of fiber. And we know dietary fiber, the majority of the UK population do not have enough dietary fiber, and this has a real impact on our gut microbiome, our bowel habits, and our general digestive health. And we know there's massive research at the moment which is looking at the microbiome and our digestive health, and how we can really improve our gut microbiome, because it's implicated in a lot of different things. There's also studies showing that's been implicated in our cardiovascular health, and the connection of the different bacteria in our gut. And I think there was some research that showed two different people having two different diets, and it's the comparison of their gut microbiome is absolutely stark. So it's just thinking a little bit differently sometimes about food groups. And I felt this was a lovely way of just thinking about how you can get different aspects, apart from, as well as fruit and vegetables, which are obviously vital, getting different parts of a plant-based diet in your diets. So the NHS Eat Well guide, now obviously we know that it can be challenging sometimes financially as well for everyone to be adopting plant-based diets, and sometimes it's difficult to know where to signpost patients. But the NHS Eat Well guide is a very good guide for some patients. It does help with achieving a healthy, balanced diet. And as I said before, it divides food into 5 main food groups. So classically, what everyone would think about, meat, dairy, carbohydrates, fruit and vegetables, etc. But this website really goes through what different foods you can include in different food groups, which can be beneficial, and how to really balance that between in your diet, because that can be the real challenge. And it's also knowing what counts as your 5 a day. So a portion, I don't know if anyone knows, but it's 80 grams of fresh canned or frozen fruit and vegetables, 30 grams of dried fruit, which should be kept to meal times, or 150 milligrams of fruit juice or smoothie. But just remembering that those can be quite sugary. So this is a really good guide if anyone wants to or sometimes plant-based vegan type diets can be quite intimidating. So this is a good start to, if you're feeling like your diet is a bit off track, you're eating a lot of ultra processed foods, this is a good guide just to go right back to basics and see where you can improve on improving your diet. And I just thought I'd finish just to see that lifestyle medicine and the British Society of Lifestyle Medicine are doing amazing things at trying to transform our healthcare through lifestyle medicine. So I know this webinar series was about diet, and I've taken this slide straight from the BSLM website, but it's also about lots of other things. So we know diet is definitely a part of our overall cardiovascular health, but there's numerous studies that have showed other things really benefit our cardiovascular health. So things like social prescribing. So where I work in Solihull in my GP practice, we have a social prescriber who is excellent at just helping patients with things like loneliness, finding work, voluntary groups for our elderly, because all of these things really have an impact on our overall health. So you could be eating the best things, you could be eating the healthiest in the world, but we have to look at our healthcare in a holistic manner. So looking at things like health coaching, person-centered care, shared decision making, all of these things which can sometimes get lost when we're talking about one thing in particular, for example, diet. So I just thought I'd finish on this just to bring home the point that our health is governed by lots of different things, not just diet, but obviously diet is a really important thing. And I think looking at our health in all these different aspects can have probably the biggest impact on our cardiovascular health. So yeah, that's it for me. Thank you very much.
Thank you so much, Raj. That was really good presentation. And we have got Serena, Dr. Serena Rekha, GP with special interest in lifestyle medicine. So that will be good actually that was good end actually for her to catch up on the other aspects of lifestyle medicine and diabetes as well, and how lifestyle medicine and diet, with the help of that, we can improve the health of diabetic person. So I think now I'll pass over to Serena for her presentation. Do you want me to put the presentation on, Serena?
You
I'll
could,
just, yeah.
yeah, I'm just trying to share it still from my end because I think it will be easier and less hassle for you, but it's not letting me do. I'm clicking on share screen. Oh, hang on, let me just click on that. Can you guys see that?
Yes, yeah, that's actually, yeah, fantastic. If you can just put it on the full screen mode, then that will be, yeah, fantastic, Serena. Thank you.
Thank you. Thanks so much for having me, everyone. My name's Serena and I am a GP in Rowley Regis, and I've been asked to talk about diet and diabetes, and there is so much overlap. So I do apologise if I'm repeating myself because I know it's been covered by my colleagues as well. So the kind of assignment that I was given was to provide appropriate information and signposting to those supporting residents to enable conversations around these topics. And my topic is diabetes. Sorry about that. Let me go forward. Yeah, so what I wanted to do was just spend the next 15 to 20 minutes talking about diet and diabetes. But before I do that, I wanted just to sort of introduce myself and who I am and what I do kind of day to day, and touch on the concept of lifestyle medicine, which Rajiv has nicely put on the last few slides of his presentation. And then I'm going to speak about sort of what it feels like to live with diabetes and sort of sharing anonymously what patients have said to me over the last sort of few months, especially over the pandemic. We're going to talk about barriers in the community and how we can overcome these, and who can help, and other resources that I use day to day. And then we're just going to finish off with, I thought I'd share sort of the template that I use when I'm doing my consultations as a GP, and how this can be used by virtually anyone, I guess. You don't have to have a medical background. You don't need to throw stats at anyone or your clients or patients, whoever you're working with. We're just trying to kind of strip it back to basics and make it personable to each person, because we are all so diverse. And then I'm going to finish off with some do's and don'ts. So my background, I'm born and bred in Birmingham, and I qualified as a doctor in London in 2010. And then I came back to finish my GP training up in Sandwell and City Hospital. And now I work in Rowley Regis, and I've been there since 2015 as a trainee, and then I stayed on as a qualified GP. My typical sort of working week is 4 days as a GP. So I do the sort of bread and butter of GP, like most GPs, but I'm also a GP trainer. So I look after junior doctors who want to become a GP and try my best, try my hardest to keep them in Birmingham, because it is by far the best city in the UK. I also do dermatology clinics, and we've sort of touched on this with Chi-Chi's presentation, with the interaction of sort of, how our lifestyle can impact our skin health as well. So I do that once a week. I'm also soon to qualify as a health coach, and I felt that this was really important for me to be able to connect with my patients a lot better, because what I've learned in medical school is perhaps a little bit outdated now, and we need to make it more current. But I'm also looking at developing formal lifestyle medicine clinics with a couple of colleagues at my practice within the GP setting. With a focus really on diabetes and weight loss. And we're going to touch on why diabetes and weight loss is a really important aspect, a really important part of general practice, because it just affects so many other parts of the body and everything else. I also am a clinical advisor to Duty to Care, which is a charity based in London. And if anyone knows, if you're an NHS worker, or if you know anyone that works in the NHS, we provide free therapies for NHS workers, whether that be personal training, health coaching, cognitive behavioural therapy, counselling, meditation, you name it, we try and cover it. But I also run a blog, if anyone is on Instagram, called @FitHabitGP, and I do a bit of writing for Women's Health magazine as well. So my kind of niche is dermatology, but also lifestyle medicine. I just want to kind of spread, you know, the concept of lifestyle medicine like wildfire, and you guys will hopefully be able to promote this through our communities. So lifestyle medicine is a really important part of general practice. 70% of our consultations, whether that is here in the UK or in the States, are related to lifestyle medicine conditions. And lifestyle related conditions are things like diabetes, like COPD, like obesity, like osteoarthritis. It's really like the bread and butter of what we see in general practice. And lifestyle medicine as a sort of subject, if you like, is using high quality evidence from research and studies to influence evidence and guidance to help treat people using lifestyle medicine first and then medication. Of course, we use both of them hand in hand, or we try to anyway, but it really puts lifestyle medicine at the forefront because we can pump and sort of prescribe loads of different medications, but we know lots of people still, it doesn't cure people's symptoms and how they feel. So we always try to look at lifestyle first. And there is power in our daily habits, you know, to change how we experience life and how we experience conditions as well. You know, especially as we get older, we're all going to be diagnosed with certain conditions. And it can also affect how many medications that we prescribe as GPs. Lifestyle medicine doesn't use any evidence from blogs or personal experience. And this is what I found when I started my Instagram account last year, that there is so much health and wellness out there, but you have to be really careful about what supplements, what, you know, what things you eat and drink. And, you know, it's, you know, you have to be careful because it can affect your health in a detrimental way. And it is not functional medicine. So this is another very separate area, often used in the private sector, and private sort of functional medicine doctors sort of use or encourage the use of testing of hormones and various chemicals in our body that are not well proven at the moment. And so, you know, we don't encourage it. And it for me, it sort of just makes life a lot complicated. So lifestyle changes do not need to break the bank. No supplements. You don't even need a gym membership. Like, you know, it's just, we're just trying to keep health simple, and we can start with our own health and what we do day to day, and then help our household, and then help inspire friends and family. Can you just turn that down? Sorry. So lifestyle medicine is not just about weight loss, and it focuses on these 6 areas that I've sort of put here. This is from the American College of Lifestyle Medicine. And when we have a patient in front of us, we're looking at sort of at their eating habits. So what do you eat? How do you eat? You know, when do you eat? Why do you eat? These sort of things. We look at substances such as smoking, drug use, alcohol intake. We look at sleep quality. We look at relationships. Who is in your network? You know, what are your relationships like? So are they supportive? Are any relationships detrimental to your health goals? We also look at stress, and there's a huge, you know, lots and lots of evidence of how stress can sort of affect different parts of the body, and how our diabetes, for example, can be managed. And we also ask about exercise. Do people exercise? Can they exercise? You know, this is going to be a little bit limited, for example, if you've perhaps got someone that is bedbound for a particular condition or what have you. So diabetes, or any other condition for that matter, can affect someone's ability to work, their ability to earn a living, ability to function in their household, look after dependents, how they manage stress day to day. Sorry about that. And their outlook on life and their length and quality of life. Sorry for those noises in the back. Can you just close the door, please? Brilliant. So I wanted to talk about the consequences of diabetes, and I was really sort of humbled that you guys asked me to talk, because I think if we're going to start anywhere in our community, it is with diabetes and obesity. And it's because there are so many consequences of diabetes. So, you know, even at a young age, in childbearing age women, you know, 20s, 30s, 40s, if you have diabetes, it causes a high risk pregnancy. You're going to have a lot more monitoring if you are diabetic or become diabetic in pregnancy. But it also can have consequences on our blood pressure. It can cause kidney problems. Diabetes can also cause glaucoma and other sight-related problems, high cholesterol, leg ulcers, weight gain, which can lead to pain and arthritis. And all of these combined can lead to depression and other mental health problems. And automatically, when you have someone, and this is not to say all diabetics have all of these conditions, but most diabetics that I speak to and look after will have 2 or 3 different things, and all of these things will need medication in themselves. So automatically someone may be on 4 or 5, perhaps 6 or more medications. And so this is why I think diabetes is a really important place to start, especially in general practice. But the consequences of having all of these conditions can lead to stroke and heart attack, reduced vision, mobility issues, problems with blood vessels supplying the legs, amputations, worst case scenario, all of which can lead to disability and inability to work, and frailty and loss of independence. You know, where I work up in Sandwell, there are care homes popping up left, right, and centre, you know, it's because we are getting older, of course, but you know, all of these types of conditions which cause disability can make us less independent. So I've done a little bit of research in my practice. We have a practice population of about 50,000, which is a huge patch. And we can't speak to everyone with diabetes, but we've done like a little selection of what people think about their diabetes. And this is what some people have said. It runs in my family, so I knew I was going to get it. I wish I knew what to do. You know, this really kind of, all of these are really like, they just hit your heart, because it's like, what are we doing, you know, in our communities, and what are we doing in general practice? I thought the only way to treat it was medication. It's like having a noose around my neck. So many tablets, and I'm always at the GP with something. It's worse than cancer, you know. I don't like taking all these medications. So yeah, this is what people have been sort of saying, and some of the things. And I wanted to just share that with you, because I think, you know, diabetes is something that affects everyone and people around those people that are affected. But what does it mean for the NHS if we don't tackle diabetes? So more of the population with complex conditions equal more demand on the health service and longer hospital stays, longer GP appointments, and people coming with lots of different symptoms that we may not be able to treat, more medication and more side effects. And it's affecting mental health for patients and the impact of staff as well. It's people are taking longer time off work and more sick notes for patients too. So this is it just snowballs, and it becomes so huge, and you just think, how are we going to tackle it? And this sometimes overwhelms me as a GP. But we also need to realize that diabetes is not, when you see someone with diabetes, or if you see someone perhaps that is, you know, overweight, maybe a little bit overweight or what have you, or it's you know, people will say, oh, you just need to stop eating crap, or you just need to get on an exercise bike or whatever. And, you know, these might be, you know, some of the negative things that we associate with, you know, when you are diabetic, or if you're obese or overweight. But there are lots of other barriers to good health. You know, long working hours, working from home, we're sitting on our butt all day, we're not exercising, shift work, you know, night shifts, you know, disrupted sleep, all of this impacts on our health. Having multiple jobs, a lot of my patients have multiple jobs, and we also have multiple roles. All of us, you know, you're doing one job, but you're also a parent, but you're also a carer for your elderly parents. Like, all of this impacts, and this is all types of different stress. So the increased stress levels determines our energy, doesn't it, at the end of the day, to make food? Can you cook a healthy meal if you've worked 2 jobs and you've been rushed off your feet? And this then causes less time for our own health. Culturally acceptable, I put this in there just because, you know, you don't often see, there'll be certain types of people in the community, perhaps, like I'm just speaking from my experience as an Asian person, that, you know, I don't see Asian elderly people at my gym. So there'll be some people that just think, oh, I can't exercise because I just can't go to the gym, or they just feel it's not acceptable in their communities not to exercise, like we just didn't do it and we're not used to moving our bodies and challenging our bodies in certain ways. So that can be a barrier as well. Financial, you know, Rajiv touched on this as well. You know, better food does cost a little bit more. You know, if you're going down a supplement route as well, you know, how much is that going to cost? Expensive gym memberships, food apps and delivery. You know, if I've had a long shift, it's 5 clicks and my pizza's on the way in 10 minutes. So it's really very easy to slip into this bad choices of food, and the impact of long COVID, which we don't know yet. And I wonder whether I listened to a live chat on Instagram between Tim Spector and a chap that I can't remember his name now. And we were talking about sort of whether food education should start in primary schools, you know, and not labeling foods as good or bad to kids, but just knowing what whole foods are and these new concepts, so we can just, it becomes automatic when you're older and you're able to make more independent choices. And also just confusion about foods. Again, you know, we've spoken about this, you know, organic, not organic, plant-based, not plant-based, meat, process, like the list goes on. Like even me as a doctor, I'm really confused about what I should be eating. And so I don't expect my patients to understand a lot of these things that are flying around sort of on the internet and social media and things. So I wanted to move on now. I hope you guys are doing all right. I know it is a Friday afternoon, but I wanted to share some resources that I use with my patients. And this book, you may have come across it. It is endorsed by Diabetes UK, and it's a really easy sort of pocketbook of pictures. And it goes through different types of foods, so Afro-Caribbean food, Asian food, Arabic food, English foods, and it gives the sugar cube equivalents of the different types of foods that we eat, because most diabetics will say, Serena, I don't know why my sugar's going up, but my sugar's going up and I'm not eating sugar. I don't eat chocolate. I don't put sugar in my tea or coffee. Where is this sugar coming from? And it's because the sugar is coming from these non-sugary tasting foods. So things like naan breads, chapati, rice, you know, rice and pasta and things are like a huge one, but this just gives you an idea. So I flick through this book with my patients and say, right, tell me what you eat, or they'll bring some photos in and they just show me what they eat and I say, okay, which portion do you eat? And that's the amount of sugar. So then you can just see people's jaw drop, because they're like, that is where the sugar comes from. And it's not to say you can't eat any of these foods. We can all eat these foods, but we have to be mindful of it, even if you're not diabetic, because of the impact of like refined sugars on our bodies. But it also just tells you to be aware of sort of portion control as well. Carbs and Cal have a website as well with some free resources on there. This Carbs and Cal World Foods book I got from Amazon. It's like $12.99, and it's just really useful to have around. The other guy that I must mention is Dr. David Unwin, who is a GP up in Liverpool. He has got loads of free resources on YouTube, and he's worked with the Public Health Collaboration as well. He's an absolute wizard. I love speaking to him, and I met him virtually this year because he's helped his diabetic patients come off medication or reduce their medication and lose weight. And he's done this in his own time at his GP practice. And he's on YouTube, just to show you some links. All of these are free, by the way, and the Public Health Collaboration website as well. So he's devised these sort of common food tables, if you like, with a sugar cube equivalent. So it's the same as the World Food Books, sugar teaspoons, should I say. So for example, if you have basmati rice, you have 150 grams, which is probably a little bit on like a big plate. It's 10 teaspoons of sugar. Like, I didn't know that. And I have a mountain plate of rice, but after seeing this, I reduced it down. If you have some boiled potatoes at 150 grams, again, if you're weighing your food out, which some people can do to aid weight loss and help diabetes, 150 grams are about three boiled potatoes on a plate, 9 teaspoons of sugar. So you go through, and he's got loads of tables like this with the sugar teaspoon equivalents on there. Things like your broccoli and eggs, virtually no sugar. Similar foods, chicken, oily fish, almonds, mushrooms, cheeses, and lean cuts of meat would pretty much have the same as well. And your healthy breakfast, I love this one because I've lived on this breakfast for about 30 years until I saw this. And it's about 6 teaspoons of sugar, and I'm having that 5 or 6 days a week. So 30, this is assuming we're measuring 30 grams of bran flakes, which is hardly anything in a cereal bowl. We all overeat in terms of recommended portion sizes on food labels. But yeah, that was a massive eye opener for me. The other guy that you might have known, again, on YouTube, on Instagram, he's got books, he does live chats on Instagram and podcasts as well, Dr. Rangan Chatterjee, who's also worked with the Royal College of GPs and has lots of sort of resources that, around lifestyle medicine. So the next bit is who and what can help. You know, what can we do in the community? And we have some of these already, you know, especially where I work in Sandwell, there's things like community exercises, walking groups, you know, discounted gym, leisure centres. What I found is where I work is that sometimes these are short-lived, so they give people an offer and then it's, and then people start paying the full amount or what have you. So sometimes these are short-lived, but it can give people that kind of initiative to like go and that incentive to go. We're exploring the idea of group consultations, which I guess a lot of people could do in the community with, you know, culturally similar people, especially if you're trying to tackle a language barrier, and group consultations to educate people on things like the sugar cube equivalents, and then have a session on importance of sleep and ways to manage stress and things like that. And sometimes when people work together in a group, which is what we're trying to do in our general practice eventually, is that people support one another. Some people might get a bit competitive and want to do better than the other person and what have you. So it just generates that little bit of motivation, and people motivate each other, and it is far better to reach a health goal when you've got someone supporting you. Promotion in common places I thought about, where people congregate, restaurants, places of worship, that sort of thing. You know, could we incorporate local champions or representatives to recruit people from different cultural backgrounds? You know, does it really need to be formalized, or can we start doing it in our own household and our own community? You know, what about the use of patients as experts as well? I've spoken to a few patients who have lost weight and brought their sugar levels down, their cholesterol down. And I said, look, can I give you a call back? Because I think you would be amazing to speak to other patients about and sharing your story. So many people have said, yes, I'll do it. Everyone loves a good transformation, don't they? I'll pop Adele on there as well, just as a reminder. But there are lots of different ways to get a healthier lifestyle. So just lastly, I wanted just to talk about the sort of template that I have made in my head to sort of help people through a consultation. If people come to me, you know, often doctors will say, oh, Serena, I've got this patient that really wants to lose weight, and, you know, told her about your diabetes and that how you can bring the sugar down. So I bring people in, and these are the stages that I do. So the first stage is I just ring them up and I say, look, can you bring a food diary in the form of photographs? Because most of us have got camera phones now. And taking pictures of the food gives me information about not just the types of food, but the quantity. And I ask people to take photos of their drinks and their snacks, their takeaway coffees, alcoholic drinks, what have you, everything for 4 days. So 2 days in the week, and a Saturday and a Sunday, because what we eat on the weekdays and weekends are different. And I ask people whether they've lost weight before and how, what worked, what didn't. Were you miserable on it? Often most of us are when we try and diet and restrict our food. Ask permission for them to be weighed, to use the BMI as a guide. And also just to say, okay, you know, you said that you wanted to lose this amount. Let's see whether we can get you there, and over how long a period of time. How would this is a really important thing, which I've learned from my health coaching, actually. You know, what would it mean for you to lose that weight? And how would you feel if you lost that weight? And let them answer. You know, what could you do in your life when you lost the weight that you can't do now? And what would you hear from people you know, if you lost the weight. So take your time to make it really personable, because they say it themselves and they know they want it and they know they can do it after this sort of consultation. And then I set goals and arrange a follow-up, and set goals could be anything. You know, some people come to me and say, Serena, I can't do weight. I can't figure out food yet. I'm not ready to change my food. Let me just focus on getting a couple of litres of water in a day and 8 hours sleep. And I was like, great, let me see you in 4 weeks' time. So do's and don'ts: do offer your client to bring a relative to the appointment, you know, the chef in the house, the person that does the cooking, because that's really important as well. And it rallies some support for that person to lose weight. Take time to listen to people and how they experience their diabetes as well. Remain non-judgmental. And be willing to learn about someone's culture, their family setup, and the barriers that have stopped them in the past from reaching their health goal. Ask your clients where they feel they can make changes first. The massive don'ts here: do not suggest multiple changes at once. So the people that need the most changes need the smallest steps towards that goal over a number of months. You know, I set that after that first consultation. I say, well, this is going to take 6 months or 12 months. Like, it's not an overnight fix. Give medical advice. Don't give medical advice based on your own personal experience. And do not suggest supplements that have worked for you or for people that you know. You may be unaware of what medications people are taking for their diabetes and the interaction of those diabetes with supplements. And do not compare your clients to each other. And I think that's really important. I had a personal trainer a few years back, and one girl, well, when I finished with that personal trainer, another girl came up to me and said, oh, you know, so-and-so said that Serena's Asian, she eats Asian food, why can't you lose the weight? So just don't ever compare, you know, your client's journey to other people that may have been successful in a different way. I think it's just so important. And definitely don't advocate anything like this. This is not linked to diabetes, but it just enraged me in the Daily Mail and the Mirror this week about a torture device to close someone's jaw to stop them from eating. Just don't go there. So to summarize, you know, diabetes can be tackled with lifestyle, with a prospect of people living better quality of life with no or less no medication or reduced medication, and remind people that they can potentially reduce their medication as well. Diabetes is often linked to a variety of conditions which lead to dependence and disability in later life. We know to give tailor-made advice now, so encouraging reducing portions of, you know, the usual suspects. For me, it's rice, pasta, potatoes, bread, and processed foods, crisps, biscuits, snacks, bars, cakes, and all that sort of stuff. We talked about group consultations and champions, and stages of my consultation and the do's and don'ts, and no need for diets, no cabbage soup diet, please, no fads, no weight loss, no supplements. Let's just keep it nice and simple. I hope that's okay, guys. And these are some of the resources that I use. I didn't mention these guys. British Nutrition Foundation is a really good website. Tim Spector, Amazon Books and Instagram, and Zoe Nutrition, which she's linked with. Zoe's a company in America, soon to come here, but talks about sort of sugar levels and things like that in the body and the impact it has, especially in COVID, and Rangan Chatterjee, of course. So thank you so much. And yeah, I'll hand it back to Vasudha.
Thank you so much, Serena. That was really good presentation. Got a few questions for you. We'll, I think, go on to the questions. As most of the diabetic diet suggestions put emphasis on carbs and glucose, any recommendations on high protein and low carb diet plans?
Yeah, sorry, I'm just going to try and bring this back so I can see you guys. Sorry, could you just repeat that question?
Yes. As most of the diabetic diet suggestions put emphasis on carbs and glucose, any recommendations on high protein and low carb diet plans?
Yeah, I think there is. So David Unwin. So this is exactly sort of a little bit of a dilemma that you're in. So when we reduce our portions, all of us are going to get hungry. And so David Unwin has advised, and I've done this as well, you can increase your quantity of your green veg, your rainbow diet, if you like, to keep yourself full, and things like lean meats, and protein as well. So I would be aware, I would be just things like in context of diabetes, so things like these protein powders and sort of protein bars and all of this, which are really good for you, and you can actually meet your protein target if you use things like MyFitnessPal. They do work, they are okay, but I'm not sure the sugar content in diabetes. But we're trying to promote, as Rajiv said, like this concept of whole food. It's fine to have a chocolate bar, it's fine to have a protein bar, they do taste yummy and they do up your protein, but they're still classed as processed. So yeah, but people, we kind of just do a little bit of a trial and then repeat the bloods in sort of 3 months to see. But this increased protein and fat, I guess fats as well, sort of chicken with the skin on and that sort of thing. We have to be mindful of cholesterol and triglycerides and things like that. So we want to be able to strike a bit of a balance.
Thank you, Serena. Is it safe for people with diabetes to have supplements?
It depends on what. I wouldn't, and often when I'm asked that, because people will say, oh, I've seen this in the magazine and it's an advert or what have you, I wouldn't advise it, because things like supplements, we don't know how what's in it, and no research will have tested each individual ingredient going into that supplement with all the tablets someone may be on, if that makes sense. So I stay away from it. It just keeps it a bit easier and actually saves people money as well. Yeah.
Thank you. Money management is often part of the problem when looking at food costs, like takeaways. Some processed foods are more expensive. Any tools you have come across?
Foods that I've come across for what, sorry?
Money management is often part of the problem when looking at food costs. That is, takeaways and some processed foods are more expensive. I didn't get that. Any tools you have come across?
Tools, sorry.
Any tools? Yeah.
I think in terms of, I mean, that's a bit of a tricky one. I'm not too sure. I think what have I think, having those apps are tempting, aren't they? Just a few clicks, a lot of our cards are saved on our phone now, isn't it? So you don't have to enter any card details and things like that. I would say uninstall those apps. If you're thinking about a tool perhaps to stop eating takeaways, I think that might be the question. I'm not sure, or if they could clarify for me, that would be great. Food prep.
You can probably unmute, Gary, yourself and ask the question, I think.
Or things like meal prep can help a lot of my patients. They'll meal prep. So I mean, I guess the only thing is it can be a little bit boring, but if people have 2 or 3 different choices of a breakfast that they can make.
We also talked about Whisk app, Whisk app on one of our webinars. Actually, it helps choose. It helps with the making meals, healthier meals, and it gives you nutrition value of your meal and ingredients as well. So if that answers. Oh, sorry, can't unmute. I think we are running a bit over time as well, so I think we'll probably have to stop there as well.
Or if they can type the question.
So I'll just go to one of Gary's question. Is there any further research related to the benefits of organic produce, trying to choose the freshest produce and consuming in minimal time? Maximum benefit is also a good message.
I mean, if you want to find an answer for something, there will always be a piece of research out there. And I think organic is perhaps, I don't know if any of the other speakers would be able to answer this. If I can just get my patients to eat 5 pieces of fruit and veg a day, I don't really care whether it's organic or not. But it's just like snacks that are not, a snack bar or like, a pastry or something. So I think there will be, and the other thing which Rajiv might have spoken about as well with the plant-based, there's this push now because things like to harvest sort of meat and have these farms like chicken, loads of chickens, loads of cows. Like you know, it's environmentally damaging as well, because there's this high protein thing that you see, you know, it can damage the environment. Some of these processes that we do to get cow to the table, for example, you know, all these industrial big kind of factories that do that. So there is that push, isn't there, to you know, to sort of have as many plants in the diet as possible, and substitute salts as well. For, I mentioned about salt, but salt with spices and things like that.
Thank you everyone. Thank you for joining today's webinar. It was really good discussion and good topics covered by Raj, Serena, and Chichi. Thank you so much, Serena, Raj, and Chichi, for presenting. And we'll be sending a feedback form as well. So everyone, if you could spare a couple of minutes to fill the feedback form, that will be really good. Thank you. And I'll close the session then. Thanks.